Hey guys, all right, so I'm making a short video for you that goes over all of the anatomical movements of the synovial joints. There's a chart in your book or in your packet, and then you're also gonna use book pages, I think it's 166 and 167 or something like that, to make sure you understand all of these, all right? So first, all of these motions except for one have an occurrence and then an opposite. So they come in pairs, almost all of them, all right? So first I'm gonna start with flexion and extension. Flexion means that you're going to decrease an angle. Extension means you're going to increase an angle. So if I'm talking about flexion of my elbow, flexion, here's the angle. I'm going to decrease it. Extension, I'm going to increase it. Flexion and extension can happen at the elbow. Flexion and extension can happen at the knee. And, I hope I don't fall, flexion and extension can happen at the hip. You can also have sometimes hyperextension, where you go further. So hyperextension of the hip would be going back. If I hyperextended my knee and my elbow right now, I would end up at urgent care. So I'm not going to do that. So flexion and extension. Next ones are abduction and adduction. Abduction means going away from the midline. So I can abduct my shoulders, the glenohumeral joint. This is my midline. Going away is abduction. Coming toward the midline is adduction. So the famous move for this is jumping jacks. Abduction, adduction. Going away, coming towards. Going away, coming towards. You can also abduct and adduct your fingers. Away and towards, away and towards. Next one is elevation and depression. I think elevation is fairly common. The number one thing that we elevate is our shoulders when we don't know what's going on. Elevation means we're going to elevate, we're going to go up, we're going to move superiorly. Depression, we're going to go down, we're going to move inferiorly. Elevation, depression at the shoulder or the glenohumeral joint. Elevation, depression of the jaw, the temporomandibular joint. Elevation, depression of the jaw. Next is, this is the only one that doesn't have a pair, this is circumduction. This can only happen in the glenohumeral joint, and it can only happen there because it's a ball and socket, and the ball and the socket are not very deep. So circumduction is when you're doing your arm circles, one way or the other way, whether they're little or they're big. All right, so swimming, it's a lot of circumduction, no matter what you're doing, all right? That's the only way that that can happen, and it doesn't have a pair. Next is protraction and retraction. Protraction is going to be pushing forwards or away from the frontal plane, and retraction is going to bring back. So protraction is moving forward in a way. So if I take my shoulders, my glenohumeral joint, I can protract, and then I can retract. We do this a lot when we do push-ups. Protract, retract, and it's the movement of my glenohumeral joint. You can also protract and retract your jaw. See? Protraction, retraction, protraction, retraction. Although you shouldn't do that. You'll end up seeing a dentist or an orthodontist. Next is medial rotation and lateral rotation. Medial rotation means rotating towards the middle. Lateral rotation means rotating away, so laterally. So medial rotation, two easy ones, glenohumeral and coxal joint, the hip. So my shoulder is out here. If I move my arm across, I'm rotating medially towards the midline. If I rotate out towards the outside, I'm rotating laterally. So medial and lateral. I can also do that with my hip, especially if I'm in flexion. I can rotate medially and I can rotate laterally. Notice this happens in ball and socket joints, which is why it can do that. So medial towards the middle, lateral away. Fight scenes. These are all medial and lateral rotation, okay? Next one is supination and pronation. Supination and pronation happens when we're talking about our palms. Supination is palms up or rotating palms up. So that is the movement of supination. Pronation is rotating palms down. That is the movement of pronation. Supination, it's like, I want some soup. Pronation, I don't like the soup. Throw it on the floor. Or maybe the Macarena. Supination, pronation, supination, pronation, and over again. Remember, it's the movement. It's not just sitting here that makes it supination. It's that movement. Moving to palms up is supination. Moving to palms down is pronation. They are all movements. They aren't static. Okay? For the last two, we're gonna take a look at my feet. All right, so now we're gonna talk about inversion and eversion. Inversion is rotating my ankle, which is our talocrural joint, rotating our ankle out and looking at the inside of our feet. See, the inside, my insoles. This is inversion. I'm looking at the inside of my feet. Eversion, hopefully I don't fall. Eversion is uncomfortable. Eversion is how we get a lot of sprains. All right, that's rotating the soles of my feet out. Okay, rotating the soles of my feet out. Inversion and eversion only happen at the talocrural joint. The last movements are plantar flexion and dorsal flexion. Plantar flexion also only happens at the talocrural or the ankle joint. Plantar flexion is going up on my toes. So think plantar is point. Dorsal flexion is going back on my heels. So think dorsal is the back. The dorsal fin is on the back. So dorsal flexion going back on my heels. Plantar flexion going up on my toes. All right, so those are all the movements that you need, the movements of the synovial joints. Make sure you fill out that chart. Make sure you use the book to help you as well. You will have a quiz on these later on. If you have any questions, see me sometime during resource. Thanks, guys.